Bill, thank you. New at 11. If you live on the lakeshore, scientists at Grand Valley State University are studying your toilet, or at least what goes down your toilet. It's part of a pilot program to detect COVID-19. And News 8's Whitney Burney joins us now from the newsroom with how it all works. Whit.
Well, Lindsay, Grand Valley is one of 17 places across the state that is doing this wastewater research. They say so far they haven't found any sign that SARS-CoV-2, which is the virus that causes COVID-19, is actually surviving in the Grand River. However, they have found other particles associated with COVID-19 that show that levels are definitely rising. Scientists at GVSU began the pilot study back in November, looking at raw wastewater in Grand Haven, Ferrysburg, and Spring Lake areas.
When this came about, we didn't really hesitate. We wanted to lend a helping hand and, maybe inspire future generations who might want to work in the wastewater field.
Wastewater epidemiology is fairly new, but has produced significant results in the past.
Different communities have been able to see if there's an opioid issue. They were able to track polio before through wastewater sewage.
Crews have been taking weekly samples from 3 pump stations across the area. It's then taken back to a lab at GVSU where it goes through a number of processes before it's tested. It takes 3 days in total. The idea to catch elevated levels of the virus ahead of time.
We did see a couple areas that were in the moderate level that we're getting higher.
Professor Rick Radisky with GVSU says so far they have seen an increase of the virus RNA, which is what the virus uses to reproduce. He says this means there's a higher level of infection in the Tri-Cities area.
The real advantage to wastewater testing is that we can see it in wastewater up to a week before the person starts showing symptoms.
Radisky says the testing method is also a less invasive way to know the scope of COVID-19 infection rates at any given time, and it allows communities to react accordingly.
If you're starting to screen for this data early on, maybe, local officials can, place certain precaution or protocols in place to be able to prevent this outbreak to reaching higher numbers.
Professor Radisky says they plan to have final numbers on this study at the end of January. All of the data from all 17 of these studies across the state will eventually be compiled onto a map and available online. Reporting here in the newsroom, Whitney Burney, News 8.